Hi and good evening. Welcome to my show, Enlifement. My name is Doc Honeycutt, and I want to thank you for joining me. I have a really special guest tonight. But before I talk about my guest, I want to, for those that don't know me, just let me tell you a little bit about me. I'm a certified doctor right here in Charlotte, board certified. I've taken a new approach. I'm on this healthcare mission to win the face of healthcare, you all. So if you want me to come out and speak at schools, in churches, you know, I'll be there, because I just feel like we don't know what's going to happen with the healthcare, and we need to talk about it. You know, insurance may be gone 2018. So with that being said, I'm trying to do more prevention, talk about prevention care. That is why I invited my guest tonight. I have a really great guest, Miss Toni Loftin-Knox. How are you doing tonight?
I'm doing well. How about yourself?
I'm doing great. Thank you for joining me.
No, thank you for having me on. Great, happy to be here.
Okay, so tell me a little bit about who Miss Toni is.
Well, the Loftin-Knox came in because I just got married in May, so I'm a newlywed.
Yay.
Thank you. And then since then, I've also recently became a new nurse practitioner, so I had a lot of new stuff happen to me in 2017.
Okay, so you want to elaborate on it?
Well, before I became a nurse practitioner, I was an elementary school teacher, which I really enjoyed. And then I had some health issues, which caused me to going to resign from elementary education, and I had a kidney transplant. My sister ended up giving me one of her kidneys, so I had to do dialysis, and that was kind of hard to do while teaching. So I took my leave of absence, and then after the transplant, I decided to resign and pursue a career in health, because I wanted to be able to give back to my community in a different way. I was giving back in teaching, but I wanted to be able to give back because my nurses were good to me, and I would like to be able to extend that to someone else as well.
So it really meant something then, right?
It really did. It really did. So that's when I went into nursing. And then since then, I also decided, you know, I would like to be able to help my community on a higher level, on a more advanced level, being able to educate, health promotion, because that's very big in our community. So I decided to go back to school and get my master's in nursing and became a nurse practitioner.
That is so awesome. You know, I always say that I have so much respect for nurse practitioners because, you know, a lot of people always talk about doctors don't touch. You know, they're all about time and numbers. But I know for myself that, you know, I'm different. I'm a different doctor because I do touch and I spend time and I want to talk to you and find out what's going on. But a lot of them don't, you know. But
a lot of them don't. But we can tell you do. You're very personable.
So I always say that you all take time out, you know, you're going to get it right. You got to listen, you know, and find out what's going on. And you do touch. You know, it's like you have a, you know, just a relationship with your patient.
You got to establish a good rapport with your patient because you want them to be able to be honest with you and tell you the things that they may not tell another professional. You know, as a nurse practitioner, we come across so much, whether it's, you know, abuse in the home, substance abuse, or just whether that patient is not even eating. And those are things that they might not share with everyone, but you want to be able to, you know, make your patient feel comfortable and, you know, let them know that, hey, you can speak to me and I would do the best I can to address all your issues.
So what kind of environment are you in? Clinic environment or?
Clinically, yes, but right now as a dialysis, I work in a dialysis environment at the hospital, local hospital here in Charlotte. And again, that's dear to me. That's something that I chose because, again, I used to be on dialysis. Now I've then had a transplant. And when I do see my patients, I'm able to relate to them on a totally different level than anybody else because I've experienced both sides as a patient as well as a provider. So that definitely means something to my patients that, hey, I understand your pain. I know what it's like to be in the dialysis chair for 4 hours, coming 3 times a week. I can really relate to you.
And that does mean a whole lot because, you know, like with, I deal with a lot of healthy weight loss
Mhm.
patients, and I always tell them, I've lived it. I was overweight. Oh, and I also went to school. I have my undergrad in nutrition. So I think I would love hearing somebody else's story that has been through it than somebody that actually went and got a degree and don't know anything about it.
Right.
Like you can tell me hard knock. Yeah, I used to be fat. You know what I'm saying? And I will respect that. I think I would. Well, they know what they can help me because they've been where I've been
Yes.
and where I want to go. So
Absolutely. So they do. They tend to say, you used to be on dialysis. I said, yes. Well, how did you get off? And then I go into explaining to them, as doing, as your doctors tell you, because you want to be able to get onto the transplant list. On those who may possibly smoke or need to lose a few pounds, letting them know, hey, staying, eating as you're supposed to, because with being a dialysis patient, there is a lot of do's and don'ts. And that can be hard for anybody, whether they're younger or older. And again, I can relate, so I tell them my personal, hey, these are substitutions that I made. Hey, they told me I needed to lose weight before I can get on transplant list and have my transplant, and this is what I did. And then they go, well, I don't want a transplant. I've seen so many people, who have been hurt by it or end up dying. Hey, I'm here to tell you it's been 10 years, and my sister was a living donor. My sister gave me one of her kidneys, and she's doing just fine. So I am a walking testimony, and I thank God for that.
So I know we're going to talk about some other things as far as like winterizing your body, things that you can do, nice tips that you can do during the winter. But I wanted to talk about just a little bit more about kidney health. Now, what are some of the prevention things that we can do, to keep our kidneys healthy as well?
Yes, our kidneys are so important, and people tend to forget about them. But blood pressure and diabetes are one of the number one and number two causes of what causes our kidneys to burn out, our nephrons to burn out, so to speak. But keeping a track of your blood pressure, reducing salt in your diet, exercising. People, believe it or not, a 5-pound weight loss can make a big difference, and I'm sure you can attest to that. That's your specialty. As well as even with being a diabetic, because you're a diabetic, that's not the end of the world. 5 pounds, 10 pounds, that can help reduce the amount of insulin you have. That can help reduce your A1C. And we don't think about how much weight has, or we want to be thick, we want to look good. You still can be healthy looking. You can be thick. It's just a matter of what we're eating, how much we're eating. You don't have to restrict yourself and just eat vegetables, so to speak. There are different things we can do. But some small things is too much soda intake. Stop smoking. We're not going to touch on that, but smoking. I mean, it just harms us in so many ways. But if people would, and there's steps. We're not saying you have to stop cold turkey, but reducing the amount of meat you eat, eating more vegetables, getting more exercise, that really makes a difference in your blood pressure, as well as a person who's diabetic, and bringing down their numbers. It really helps. It really does.
So, but, it's like people don't get it. They'll say, well, I only had a little piece of cake, or I only had a little bit of this, but you're diabetic. So that little bit is detrimental to you. It's like eating some poison,
Exactly.
And it could be bad.
It could be really bad. And it just only take that one piece to take you over the top. And then your numbers are all out of whack, you're in the hospital, and then, when your body goes through stress like that, it harms such other things. Your blood pressure's up. Then so think about, so people don't think about how blood sugar affects them when they're diabetic. Those little crystals are going through your blood vessels, and they're constantly tearing them up. That's what causes the harm to the kidneys. Those nephrons, those tubules and stuff, your blood vessels in your kidneys are small. So when your blood sugar is elevated, it's like little crystals, little sugar crystals going through, and it's just scratching them up. Right. For a visual, for someone who needed a visual, it's just, we don't think about it that way, but that's why we have to educate. And I love to educate my patients. And normal tone, normal words, so that they understand. So that way they can actually sometimes get a visual, because we think, like you said, that little piece of cake is not going to hurt, but it does hurt.
And it's so very important, for us as medical professionals. Like you said, talk to them where they, so they'll understand. I'm talking to them like I'm talking to my mom,
Exactly.
Because I want you to know how important this is. I want you to know that, this could go a different way if you don't listen to me.
And definitely just, I leave the medical jargon at the door. You know, if I'm seeing, you know, Miss Betty, so to speak. Hey, Miss Betty, I want to be able to.
Mama name.
See, I didn't know. I really didn't know. But you know, I'm talking to Miss Betty. That I want her to feel warm and feel comfortable. I don't want her to feel like, oh, you know, here comes this medical professional and she giving me all these hard words I don't understand. Nope, I give it to Miss Betty straight in a normal conversation so she will understand.
Right. I even have my patients. I'm like, so if I know that they're going to see the specialist, I'm like, you bring me everything that they gave you.
That's right.
You know, so I can let you know, because I know you don't understand these things. I want you to know everything that's going on.
And I am happy to explain to them. I tell my mom and dad, if I can't be with them during the appointment, because they stay about 3 hours from me, hey, if you can't remember, just get all your paperwork, send it to me, take a picture of it, let me go over it with you. If you have to call me and put me on speakerphone, I will do that. That's fine. Let me hear so I can explain it to you. So they've been doing pretty good about that. So
knowledge is power.
Knowledge is so much power, and so many things that we can prevent by by having the knowledge, by having the education, and just by taking heed, so to speak. It just really helps. We only get one body, and we have to take care of it.
And listen to it. It will talk back. It'll tell you what it needs. Yes. All you have to do is just listen.
Just listen.
So let's talk a little bit. You said something about meat. Let's talk about eating too much meat.
So I myself personally have been trying to eat less meat. So I'm starting off slow. I do no meat on Monday, Wednesdays, and Fridays. And then on the other days, I try to eat more seafood, which I love seafood. I don't have a problem. I just eat more seafood, more fish. Because I do want to eventually become a pescatarian and just not eat so much meat, because I notice even in my body, the days that I don't eat, I feel so much better. My stomach is less bloated. My bowels are so much better. And I don't know if most people know, but most women have issues with their bowels, no matter the age. I speak to my girlfriends, I ask my mom, everybody's having issues with their bowels. When I eat less meat, my bowels are so much better. TMI, but they're better.
So I stopped eating meat as well, and I didn't have a reason that I wanted to stop eating it, but I wanted to see if it was going to make a difference, because I already eat clean.
I bet you felt the difference.
And I would always clear my throat, like, all the time. And 2 weeks after I stopped eating it, it changed it. Like, I don't do that anymore. So I had one of my patients this morning. She was like, oh, I wish that I could find something to stop, this congestion and, me doing it, because she do it all the time. We used to be running a race in there when, she would come see me in the room. And I was like, well, I said, I stopped eating meat. I said, it fixed mine. She was like, well, I don't think I want it that bad.
But I don't even miss it.
I don't miss it either.
I do not miss it. I have been doing really good. Some days that I'm not eating it, I'm not craving it. And then I find myself the next day, which would be Tuesday, starting off my breakfast and my lunch with no meat. So I think I'm doing a really good job. I had to get myself down to that.
Yeah, definitely. So and I look at my plate and I'm like, okay, that's that thing that says you are what you eat. Right. So I'm like, okay, I'm cabbage. It don't have no fat on it.
Right.
I'm cauliflower. Well, it don't have no fat on it either. So, I suppose to look the way I eat. I eat clean. So my body should look clean.
That's right. It should look cleansed. But look how good your skin looks.
Thank you.
So I think we can see the results. I think you're doing good.
I live by it every single day, because I know how important nutrition can be to your health.
Yes.
Exercise is good, but I'm like 85% nutrition.
Yes, it is your food to eat. Even when I was doing kickboxing, I was like, I'm not losing weight, but you know what? It was my diet. It was my diet. Yeah. So I had to be honest with myself and say, you know what? You can exercise all you want, but if you're not eating right, I'm not going to see the results that I want.
And a lot of people, they'll ask me, they're like, do you have a waist trainer? And I'm like, yep, that track out there that I go run go run at 5 o'clock or 5:30 in the morning, that's my waist trainer right there. But I don't eat bread, I don't eat pasta.
Oh, yes.
It's a lot of don't eats that, I don't eat. So
I need to get on your level.
I suppose I look like I have a waist trainer on and don't have one.
That's right.
Because, like the refined sugars,
They are right here.
They'll make it right here for you. Right.
And I can tell you that for myself. I definitely can lose, a couple pounds or more. So I'm definitely going to be taking some of your tips that you share, I can insert them into my life.
So we're going to take a quick break, but let's talk briefly about water. How important water is to your body.
Ooh, water. does everything in our body, from our hair, dry brittle hair, drink more water. Dry eyes, drink more water. You want clear skin, drink more water. You having dry mouth, drink more water. Bowel's not moving properly, drink more water. I can't stress to you how much drink more water, even with your nails, your skin. Just if you want to glow, drink more water.
Absolutely.
Drink more water. Smelly urine, drink more water. Your body needs water. Our body's mostly made up of water. It's about 70% water.
Yes, it is.
So we need more water. And we think that we're not dehydrated. We need more water. And that also, do you realize that drinking more water also helps your kidneys? So if someone's just on that verge of going into dialysis, like say if their kidney stage, chronic kidney disease stage 4, they can help to prolong them not going on dialysis by drinking more water. You know why? Because it filters out the kidneys.
Yeah.
It causes the kidneys to work more, and it filters out the kidneys.
Like I say, your body will tell you.
Your body will tell you.
But we are going to take a quick break, and I promise you we'll be back in a flash. So go get your Kool-Aid, go get your water. Potato chips, we'll be back, okay?
Yes.
Uplifting Moments with Pastor Celeste Hicks, who is the pastor of Refreshing Springs of Living Waters Worship Center, located at 3004B Beatties Ford Road, Charlotte, North Carolina, 28216. Do you need inspiration, empowerment, or encouragement? This is the show for you.
Welcome back to my show, Enlifement. And before we went on break, I promised you that we were going to give some great tips for winterizing your body. And I'm not going to let you down. So I have Miss Toni Loftin-Knox.
Yes.
Newly married. Nurse practitioner.
Yes.
She's going to set the record straight and give us some good old tips for winterizing.
So, just some safety tips for the winter. I want to start off by saying, please check on your elderly neighbors, your neighbors that are isolated. As the winter comes and the temperature drops more and gets even more colder, some of our elderly neighbors might not realize how cold it is, or they might not be prepared and have the firewood that they need, or their heat may not be working. So please do check on them. I just want to put that out there. Be a friendly neighbor, love thy neighbor, go and check on them, and make sure everybody is good. We live in a world of people, and we all have to work together. We are a community, and we just work better when we work together.
Mm-hmm.
But again, before we went to break, we talked about drinking more water.
Oh, yeah.
Keeping yourself hydrated helps with your skin.
It does.
So, and just to touch on a person who may be diabetic, as your skin dry, it cracks. When your skin cracks, what happens? It allows bacteria to get in, allows infections.
Mm-hmm.
I'm sure everyone's heard of cellulitis. That's something that can, you can wind up in a hospital with cellulitis. If it gets even worse, some people have to have their legs or limbs or such amputated because of cellulitis, a skin infection. So keeping yourself hydrated, keeping your skin moisturized will help prevent those cracks in the skin, to help prevent bacteria from getting in, because our skin is our largest organ on our body.
Yes, it is.
And it's our first level of defense.
Let them know that, Miss Toni.
Yes, our skin is our largest organ on our body, and it's our first level of defense. So you have to take care of it. You have to keep your body hydrated from the inside, and it will show on the outside, as well as keeping lotion on your skin. You don't want your skin to crack because it's dry, and as it gets colder, that will happen. Whether it's your lips, your skin, your hands, you want to keep yourself hydrated and keep yourself moisturized, because that will help prevent skin infections. So I think that's a good thing that people should know.
Grapeseed oil is very good for the skin.
Absolutely.
Because it doesn't clog the pores, and it doesn't take a whole lot to.
It sure doesn't.
Right.
And I like to mix oil in my lotions and stuff. I understand we all want to smell good. We all love Bath and Body Works. That's fine. But if you mix a little oil in there, even if you don't have grapeseed oil, everybody don't have grapeseed oil, but olive oil.
I was going to say a little bit of olive oil.
Olive oil,
Yes.
that's great too. Mix it in with your lotion, so that way, because the oil is going to help for it to adhere and for your body to soak it in. And we definitely need to keep her skin moisturized. I think that's important. But also too, as we start to get snow, which we'll probably here in Charlotte area, we get it closer to end of January,
We might.
February.
Sometimes it's hit or
Hope
miss
we
here.
get it.
Yeah.
But I still want people to be mindful of being safe. Wearing the proper shoes when you're cleaning off your sidewalk, in your driveway, slip resistant shoes. I don't want anyone falling, especially elderly. You fall, you hurt it, break a hip, break an arm or such. Those type of accidents can be prevented. So, definitely wearing the proper shoes is important. As well as, now this is a topic that, or a subject that a lot of people agree on, some people disagree on. I myself, I'm immunocompromised because I've had a kidney transplant and I take immunosuppressants. So I would like to remind those of us to get our flu shots. It's important for me. I do work with the public. I see people, all different types of illnesses. So I do get my flu shot. It might not be recommended for everyone, but the vulnerable population, which is your elderly, your diabetics, anyone with chronic health conditions, whether it's heart disease, high blood pressure, diabetic again, and the younger kids, when they go to daycare, as you notice, I'm sure all mothers notice that when kids go to daycare, or school, they bring in the germs home to the others and the whole family is sick. So again, the vulnerable population, which is considered the elderly, immunocompromised, those with HIV, chronic health conditions, it is important, I do believe, for them to be to get their flu vaccine. I believe so.
Well, I wanted to say let's talk about some other prevention things, like washing your hands.
Absolutely.
We talked about vitamins a little bit before we
sure
came on,
did.
so let's hit those things as well.
I'm an advocate of vitamins. Take your vitamins. You'll be surprised of a lot of us are on the go. We're eating fast food. We're eating a lot of empty calories, food that does not have vitamin rich ingredients in them. Our favorite thing is the vending machine, but there's no vitamins there. So please take a vitamin supplement. I think that would really help because we want to keep our immune system strong. Kudos to those mothers who breastfeed because your baby gets your immune system. That can't be that's something that is just, I think is magnificent for those mothers who do choose to breastfeed, and I'm 100% advocate of that because again, your baby gets your immune system is strong, and your baby can use that. So definitely taking vitamins, eating healthy, more vegetables, again, drinking more water, all that will help our immune system be strong.
But we didn't need all of this, like the supplements, when everybody ate off the land. We didn't need, and that's why it's important. Don't just take supplements. Take supplements that your body can use.
Yes.
Like my multi mineral supplement is a wholesome food vitamin.
Mm-hmm.
You want to take something that's made up of fruits and vegetables. Yes. That your body need, because like a synthetic vitamin, your body's only going to use like 30 to 40%.
Right,
of
and
it.
the rest of it we're just going to pee on.
Right.
It. Yeah.
And some things your body don't need because your body makes it anyway. Like calcium, your body makes calcium. You don't want to give it too much because your body makes it. So
exactly.
Just know what your body needs. When you get your blood profile, when you have your physicals, go. Let them tell you what's low. They do all the calcium and everything right there too. So. Vitamin D. If it's low, then use it. But if you're watching like Dr. Oz or some of those other doctors, they'll have you taking everything in the vitamin shop. You don't need on it, right? No, you don't, because like I say, your body makes some things, and some things that your body don't make. You need them. You need a little help, especially if you're not eating right. Now, It makes a big difference if you're not eating. Your diet is not the way it should be.
Exactly. And then too, as we age. Everyone needs something different according to their age group. A young woman who's looking to get pregnant soon may need more folic acid, vitamin. An elderly person may need more calcium, more vitamin D to keep their bones strong, to prevent fractures and breaks. So I think it just depends, like she said, whatever your lab work suggests. I think that's what we need to take in our body.
But I think they just look at the big picture, a lot of times, and not look at like the little small things. Like now, I think they're catching on more to like the potassium and all that stuff because it's
Well, don't get me started.
Let's get you started because they need to know.
Well, working in nephrology, potassium, and again, my background is with dialysis patients, and since their body does not urinate like a normal person would, dialysis machine is the one that takes the place of that. So they come 3 times a week, which helps to remove all the toxins, cleanse their blood, remove the toxins, and remove excess
and that's
fluid
something that
from
your
their
body supposed to do. So
right, but when your kidneys are working normal, then your body does do that. But for anyone with kidney failure on dialysis, then they don't. So everything they eat stays in their body, fluid-wise, as well as they're eating the wrong foods, such as French fries, potatoes, Tomatoes. Believe it or not, a lot of people like tomatoes, but they're high in potassium. Oranges, high, bananas, high in potassium. Well, potassium controls the rhythms of your heart.
Yep.
If it's high, so that's not good. So definitely stay on your diet protocol if it applies to you, because that diet protocol is there for a reason, to help to keep you the healthiest person that you can be. So it is important.
Yes, it is. So we hit on vitamins, we hit on water, we hit on our diets.
Some more winter tips is definitely I want people to know if you're using a furnace or wood burning stove, or even you want proper ventilation to prevent carbon monoxide. Carbon monoxide, this time of year is when we hear about such things. Even in the car, you want to be able to prevent that. So getting proper ventilation is important if you're using those type of heating elements.
Yeah, definitely have a carbon monoxide detector, and smoke detectors are very important in the home.
Yes, smoke detectors, fire is so important. That's when we hear about fires, and you're right.
And I think more for like the seniors.
The seniors.
Because they have like the older, the older houses.
Older type furnaces,
Right.
I guess kerosene heater type things that they use. So yes, so that's important. I don't want anybody getting hurt because of a house fire. We all need to keep warm, but I want everybody to be safe too.
So, getting back to, let's talk a little bit more about kidney health. So, your sister, she gave you, she donated a kidney to you.
She did. She donated a kidney to me.
So what was the process like?
Well, the process is, she's my younger sister. So when they said, hey, would you happen to have a living donor? I said, yes, I have 3 other siblings. And they started with my sister first. She was the youngest. And she had to keep going back and getting tested. So what they do is they take my blood and her blood. She had to go quite a few times. But they take my blood and her blood and they put it together to see if it matches. So blood that does not match, it clumps up. So they keep doing that test because you want to make sure you're a good match. And there's 6 different panels that you match on. But anybody can be a living donor. And yes, she's perfectly healthy and fine with 1 kidney. But we need more living donors. We need more donors. Even if you have a loved one that passed away, that's a conversation that could be had even now over the holidays. Ask your loved one, would they like to be a donor if something was to happen to them. I know it may be an easy topic, but it's important because we need more donors. We need more donors. And you just help so many people. Whenever you do donate your donate your organs if you happen to pass away, if a loved one does, if you sign the paperwork or whatever. But as far as the living donor process goes, she just had to keep getting tested. They sent her to a psychiatrist. She has her own set of doctors to make sure that her best interest is being met. It's not nothing that she's forced into. She's not doing it out of greed or out of heroism, so to speak. She wants to be. That's why they see the psychiatrist, to make sure they're doing it from their heart. And it's something that they really, truly do. And remember, it is a donation. You can't expect someone to give you money or anything of that sort for donating a kidney to you. But it's been 10 years. I've been fine.
How was the recovery process?
The recovery process wasn't bad at all. I think she was only in the hospital maybe 4 days. I think I was in there about 6 days or so. But overall, I did really well. And again, I give all praises to God. I do have to take immunosuppressants daily for the rest of my life. Had we been a twin, if we were twins, then we would have the same, identical twins, we would have the same DNA, and they don't have to take immunosuppressants. But your doctor prescribes all that for you and determines the dose. So even though I'm 10 years out, I still go and get my blood work checked approximately every month or so to make sure I have the right amount of medication in my body, so to speak, to because my immune system is suppressed, and that's what keeps my body from rejecting her kidney. Because it's not the natural organ that I was born with. So our body naturally will reject anything foreign to our bodies. So I do have to get blood work, monthly to make sure that it's accurate.
You don't just do it while you're at work?
Sometimes.
I feel like I feel a little low.
Sometimes.
Okay, so we got a few minutes.
Sometimes I go to the lab and they can do it.
Right.
If the doctor sends the order to.
So we have a few minutes left. And, you talked about the immune.
Immune
So,
system.
now, is there some things that we can do Well, I know there's some things that we can do, but can you tell our audience some things that we can do to keep our immune systems nice and strong?
Exercising. Exercising helps to keep our whole body nice and strong, as well as it's good for your mental health. Not only just your immune system, but your mental health, your physical health. And again, we all can use, stand to lose a pound or two, so it really will help. And it helps to keep your immune system strong. Anybody with respiratory conditions, a little bit of exercise, to your ability will help to keep the lungs strong, help you to breathe better. So I do totally recommend exercise. 30 minutes a day will do a tremendous difference in your life. And before you know it, it'll become a habit, and it's something you like, and 30 minutes turn to 40 minutes, 40 minutes may turn into an hour. So I do suggest that. Even if you're staying indoors, just getting up and moving instead of sitting down, watching TV. Mm-hmm. Even if you're going to watch TV, but moving your arms, moving your legs, keeping your muscles strong. Think about how when we're sitting around and our muscles tends to get a little tensed up. But the more we move, our muscles are more relaxed.
Yes.
They move better, less aches and pains.
Because that's their jobs. They want to move,
Yes.
Yes. And I always tell people, I always say, I'm not on any medications for anything.
And that's a blessing for you to be able to say that.
Yes, it is, because my younger sisters, they are. So, I stand here blessed, and, a lot of people like, knock on wood, and I'm like, wood don't have anything to do with this. I put in the work. I put in the work, and of course we got a good guy,
Yes.
But on that note, I want to thank you for joining me on my show, Enlifement.
Yes,
Would you come back? Because I feel like we didn't even scratch the surface.
Sure, I'll be coming back. I'm happy
She's ready
to be
now.
here.
TV ready. All right, so that's my show. Thank you for joining me. You can join me right here every Wednesday, every winning Wednesday on the Wake Up Call Network. Thank you.
Thank you.